Hi guys, my name is Tiffany and I'm gonna create a mini series which will track my journey of finding out about my breast cancer, leading up into my surgery, and then I guess whatever treatment options will come next. Um, Tomorrow I'm scheduled for my first surgery, and I guess, I don't know, I could use this as like I could use the series as a way to help other people that are going through something similar, or um, to spread awareness, um, as a venting session, because it's just so many different emotions that you have when you first find out about this. I was diagnosed with breast cancer on January 19th, 2019. But my OBGYN called me in for a consultation after I got my biopsy. And he gave me the news and told me that I have invasive breast cancer. Um, However, on the paperwork, it said that I had ductal carcinoma in situ, but that um, the cancer had spread minimally, and that's why they deemed it invasive. Let me just go back a few weeks prior to my OBGYN giving me the news. I want to say sometime in mid-December, I noticed that my breast had become very tender, and I noticed just doing like a self breast exam that I had felt a lump, or what I thought was a lump at the time. I didn't really pay it much attention. I just thought that it was like premenstrual syndrome, something going on because my cycle was about to come. But the tenderness, it just was persistent, and it only got worse. So a week after I first felt the tenderness, um, I talked about it with my mom and my boyfriend, and they encouraged me to go to the doctor and not to wait on it because it could be something serious. So I scheduled a doctor's appointment, and I remember going in. I think it was December the 27th, and my OBGYN, he did a breast exam, and he told me that it didn't feel like it was much, but he still would send me for an ultrasound. So at that point, I'm like, okay, it's probably just a cyst. I'm not gonna be too worried about it. Um, so I want to say, I can't remember the exact date, but I know about a week later I went to get an ultrasound done on my breast, and I'll never forget the uh, the ultrasound technician asking me how long have I been experiencing the pain and the lump, but her face was so serious, and I'm like, uh, about 2 weeks, and she was like, okay, I have to go speak to the radiologist, and I just never forget her facial expression or the seriousness of the radiologist when she came in and spoke with me. They had me do a mammogram after the ultrasound. Um, then I had to do another mammogram right after so they could look again, and another ultrasound after that. And I was basically there in tears because I knew something was wrong. They don't really kind of want to tell you until they get all the information, but it's hard for some people to hide facial expressions. So I knew at that point, I asked the radiologist, I'm like, can you tell me what's going on? You're scaring me. And she was like, oh, well, we found something on the scan. I'm not sure what it could be, but something doesn't look quite right. So we want to set you up for a biopsy. So they sent the paperwork over to my OBGYN, and they told me to call so I could have him fax over a referral, and then they could set me up. Unfortunately, this was right before New Year's, and my OBGYN was closed. So I had to wait until the new year for them to open back. I think it was January 2nd, and they sent the referral over. My biopsy was scheduled for January 14th. I went for the biopsy on that date, and about a week later, um, I'll never forget, I was at work. This was on the 18th of January, and the radiologist called me thinking that I already knew um, that thinking that she thought that I already spoke with my OBGYN and they gave me the news. So she told me she was like, "Oh, well, I just want to discuss surgeons with you. We biopsied 3 different lumps, and 2 were benign, 1 was cancer." So at that point, I guess you could say I was really diagnosed on the 18th, but I didn't formally get diagnosed until the 19th. But at that point, it was just like I couldn't even think. Like it was like everything around me was just spinning, and I'm just sitting around amongst my coworkers. It was just a mess. Um, and all I could think about was the fact that I'm 32 years old. I have 2 kids, um, 10 and 7. Um, I mean, for the most part, I just like still have such a long life to live. So, like, where is this coming from? How did this happen? Just so many different ranges of emotions going through my head. And it was hard for me that night. When I got home, I was scheduled to go to the doctor the next day on the 19th, for the consultation. And I just really sat up on Google trying to figure out exactly what does breast cancer entail. I searched on YouTube to see if it was other people who could share their stories. I couldn't really find a lot of um, African American females in my age group that really went through this. I found one. I think her name was Marsha. But it wasn't really a lot to choose from, because I know from reading different articles that it's normally women are diagnosed with breast cancer at 40 or older. It does happen at younger ages, but it's commonly at age 40 and above. So I just kept thinking, like, why me? Blaming myself for not eating better or exercising more or doing what I had to do to take care of myself. But then I had to stop doing that to myself as well, because at the end of the day, God makes no mistakes. So I had to really come to terms with that. And instead of looking at it from the point of view of why me, I had to look at it as what can I learn or what can I do to better help myself. Because a part of dealing with an illness is not just the physical component, but the mental component of it. Luckily for me, I have a lot of support, a lot of people that stand behind me, so I'm not going through this alone. But I just basically want to create this series so if there's anybody else going through something similar, I can maybe be that support to somebody else to help spread awareness. And I just want to do different videos which capture the type of cancer that I have, the treatment options. I'm also into holistic treatment as well. I'm doing conventional treatment and holistic together, so I'll talk a lot about that as well. And thanks for watching.